Hey guys, it's Dr. Megan Faulkner with Apex Sports Medicine, and this video is going to show you how I like to work through the TFL, the Tensor Fasciae Latae, using the Ttool with a few different types of techniques. So I like the patient laying on their side here with the top leg straight, and I just feel like that reveals the TFL really easily to you. You can find it really easily by palpating just anterior to our greater trochanter and at the most proximal portion of our vastus lateralis. You can also drop off just inferior from our lateral iliac crest, and you'll find it as well. So we have a nice little strip of tissue right here. So what I like to do is take the smaller edge of the Ttool here, because it's a smaller muscle. We'll get basically the width of it using this tool, and I like to just assess what's going on with the tissue. So it'll be nice and smooth, with lots of give if we don't have any issues or tightness or knots within this tissue. But if we do have a knot in this tissue, we will typically bump up against what feels like a bump in the road, or we'll feel a little bit more of a denser type of tissue. Common reason why the TFL may be extra tight is that it's overcompensating or overworking for a weaker lateral hip or gluteus medius. So once I find, if I'm assessing the tissue, or I can assess it with the tool itself, and I find a little bump in the road there or a knot, you can use short little strokes with this same edge here to work through that knot. You can also do some pin and stretch with this tissue. So what you'll do is, so you have your spot, keep that in mind, and you'll have the patient bring their leg back just ever so slightly and abduct it. Then you'll have them hold for a quick second. You'll come back over here and you'll pin down the tissue that you found that has a knot in it, and you'll have them drop down into a deduction, and we'll hold right there. So you can continue to use this small edge, or you can flip over and grab a little bit more tissue with this big edge, or so the big rounded edge here. So I'm gonna have her do the same thing, where you're gonna bring the leg up. We're shortening that TFL tissue, going back to where I found that knot. And here I can apply really nice pressure through the tool into that TFL, and then I'll have her drop the leg down into a deduction, and I'm going to apply just a little bit of inferior to superior tissue pull to make sure I keep that tissue really nice and tight, and we hold here for a few seconds as it releases, and then we come up off of that. Another way that we can do soft tissue using the Ttool for TFL is more of a movement-based soft tissue technique. So I'm gonna actually have her pull up into abduction and adduction and keep kind of running through that slowly. And I'm going to just kind of keep working the tissue as she's moving into abduction and adduction, just to make sure that we have good tissue movement through that range of motion. And the very last thing that I like to do is make sure we have really good relative motion between the TFL and the vastus lateralis, our lateral quad muscle. So the way that we'll do that is we're going to bring her up into abduction, back into extension. I'm again going to find that nice tight spot on her TFL, put the Ttool down on that tight spot, and again apply that inferior to superior tissue pull. I'm going to have her pull down into adduction. And then at the very end, while I'm keeping that pressure and tension on the muscle, I'm going to have her bend her knee back so that we're actually pulling the vastus lateralis inferior while I'm pinning down the TFL. So that's just a few different ways I like to work through the TFL using the Ttool. Thank you.